Good morning from the show floor, RSNA 2013. My name is Shawn McKenzie. I'm the CEO of Ascendian Consulting. We're a full-range consulting company in the imaging space, not just radiology, but anything that produces data or an object or a picture imaging across the entire enterprise. So we assist big clients, large IDN clients with strategies and implementation of new technologies. The trend is it's our turn. The electronic health record for the last 6 or 7 years has sort of taken all the budget, all the attention away from imaging. Well, now imaging has become enterprising, like the electronic health record. It's no longer in a box. The word PACS or the acronym PACS is gone. You know, we're looking at imaging from anything that has an object, any type of data set across an entire enterprise. Imaging itself has become a strategy. It's become a service line bus, if you will, across everything that is or produces a picture in a diagnostic format in any way, shape, or form. So imaging has changed completely. Once again, we can't think of it as radiology and cardiology. It's anything that produces an image. We are the eyes of the physicians. So we need to produce that data and give visualization to all these things that are happening across every single ology. And that's the change. That's the big change. They have to consider what they're trying to accomplish. That's the big thing. You know, there's a lot of confusion. When you start moving out of silos and you start seeing things in a bigger picture, you have to ask, it's a stepwise approach. What are we trying to do first? What's our number one priority? Is it radiology? Is it images? Is it cardiology? Eventually, does it expand out to pathology and visible light technologies and those types of things? What is the use factor when it comes to getting out to the electronic health record, to the physicians, to the patient health record, the PHR, and how is that going to play in the imaging space? So I think some of the bigger things is the decision points are, what is our first step? What are we going to do first? What's the first, if you will, bucket of data we want to put into this thing? And then how do we expand it across the enterprise piecemeal, little by little, more and more? How do we scale it? There's a lot of questions related to that, but you know, we got to start somewhere, and that's what we help define. I think what you're going to see is an entire paradigm shift in the way that we deliver care. There's a lot of action going on with the mandates, ACA, you know, and High-Tech Act, and so on and so forth. So there's a lot of policy being driven that's trying to change the way healthcare is delivered in the United States. So if I rub my crystal ball, I'd say that we are going to see the delivery model that mimics and looks very much like exchange, not health information exchange architected the way it is today, but with a new look and a new way of doing things. I think healthcare is going to be delivered based upon a community basis and not siloed into an ACO or into a specific delivery model. I think that physicians are going to be able to access data across a spectrum of information that they've never seen before. Full sets of data. You know, looking at every piece of the patient care continuum, a longitudinal patient jacket. And the exciting thing here is that imaging is on the forefront of that. We are now bridging gaps that they've never bridged before. That's why, once again, the word PACS is not used. It's imaging strategies and so on and so forth. We're looking at a bigger scale. So we take what we do, we move it to the enterprise, and then we move it to the exchange. And honestly, quite frankly, I see radiologists actually it's almost going to be kind of an eBay of radiology where exchange and the ability to read off of the exchange is going to be the future. So you're going to be able to subscribe to the exchange, have diagnostic viewers that are capable of all tool sets, and read across a community. It's going to be very interoperable, it's going to be very dynamic, and it's going to be synergistic. That's the word. It's synergistic, and the business model will follow that.